This outbreak does, of course, continue to trigger many questions from you out there, the viewers. So tonight we are on your side answering some of the most common questions. And Michelle continues live team coverage with those answers. Michelle?
Well, Mark, I'm joined now by Jim Gross, Commissioner of the Public Health, Dayton and Montgomery County. Thanks so much for being with us.
It's my pleasure to be with you.
What we want to tackle here today is the top 5 questions that we've been getting from viewers on our 2 News website.
Okay.
The first, let's just get to it. Can you get the swine flu from eating pork? As Mark had just mentioned, there's a lot of concern over that.
Well, there's many things that we don't know about the virus yet, but we do know that you cannot get the virus through eating pork. So we do know the answer to that question.
Lovely. Maybe that's why they're changing the name as well. Well, number 2, do masks help, and are there other products that can protect us from the flu?
Most of the masks that you see are really of limited value, except for maybe in a medical setting. But what people can do is they can wash their hands frequently. They can cover their cough and sneezes, hopefully with a Kleenex, or if not, in the crease of their arm. And they can also avoid sick people. You know, if you feel poorly and have the symptoms that have been described, it would be best if you stay away from other people.
When we talk about washing our hands, this sounds so silly, but they say that we don't wash them long enough. How long should we wash our hands before we consider the germs are gone?
Yeah, that's a really good point. It is important that people wash their hands for an extended period of time and make sure they use soap and water. Sometimes people do not necessarily use soap, they just run water over their hands. But do it for an extended period of time. Do it rigorously and make sure you use soap and water.
Are we saying 30 seconds, 40 seconds?
I think if you do it for 30 or 40 seconds, I think you're probably in really, really good shape.
Great. Sounds good. Let's move on to number 3, the question. Can I get a shot or take a pill now that will prevent swine flu?
Unfortunately, the vaccines that were offered to most people in the fall and early winter are not effective with regard to this virus. The World Health Organization and their new phase that they have recently gone through has triggered things, so the federal government will be working with producers of vaccine, and hopefully we'll have a vaccine in a few months.
Well, as we mentioned earlier in our show, no confirmed cases here, but in the event of a pandemic, what are the hot spots that you're most likely to contract the swine flu?
People need to understand that if we reach a pandemic level, it will still just be like seasonal flu. So you would contract the flu just like you would in a normal setting. You know, in the fall and in the winter when you contract the flu, it will be the same scenario with a flu pandemic with this new virus.
Wow. See, we all think it's just so different, but it's just a different form of flu that we're
That's
not used
correct.
to.
Everything else is pretty much the same.
Gotcha. Okay, and our final question, why is this strain so more potent than others, or really is it?
Well, we have a lot of questions right now regarding the potency, and it's not necessarily that it is more potent, it's just that it is a new virus and a lot of immunity has not been built up in the population yet.
And we do have to remember, it was interesting reading on the CDC website that the regular flu is still very much a threat as well as the swine flu, but again, we are focused right now on the swine flu because it's different.
That's correct. We are coming out of regular flu season, and one of the confusion that's approaching us right now is with regard to the seasonal flu and the new virus as well. And through some of the testing, we have to do the seasonal flu test in respect to the symptoms that we see as well, and that's really some of the confusion that we're seeing right now is with regard to the testing.
Making it a little more complicated for us all. Thank you so much for joining us, Jim.
Thank you for having me.
Appreciate it. Mark?
All right, good information. Thank you both. There are many other resources available to help answer questions you may still have about swine flu. Montgomery County officials have that hotline you can call, 225-6217. It is open 8 until 4:30 Monday through Friday. You can also call the Ohio Department of Health at 1-866-800-1404. Those